The doors to Trauma Bay 4 didn't just open, they exploded inward, kicked apart by the panic of men who knew they were running out of time. "No pulse! I've got no radial pulse! Get me a line now!" The shout tore through the sterile hum of the overarching hospital speakers. It wasn't a request. It was the terrified command of a paramedic watching a life drain away on his stretcher. Red slewed across the polished linoleum. Bright, arterial red. It splashed against the white sneakers of the intake team, ruining the pristine order of the hallway in seconds. Elias Thorne did not look up. He kept his eyes on the grey water swirling in his yellow mop bucket. He gripped the wooden handle, his knuckles swollen and capped with thick, pale colluses that hinted at a life of manual labor, or perhaps something harder. He didn't flinch at the shouting. He didn't flinch at the smell of copper and terrified sweat that suddenly flooded the corridor. He simply squeezed the mop, the grey water ringing out with a wet, heavy slap, and continued to clean the floor 3 feet away from the chaos. He was invisible. He was the architecture. He was the grey jumpsuit that smelled of bleach and floor wax, an object to be stepped around. Move. A shoulder checked him hard, sending Elias stumbling slightly into the wall. He didn't protest. He didn't even lift his head to see who had shoved him. He knew the voice. Dr. Aris Kogan, 3rd-year resident, high pedigree, low patience, and hands that shook when the pressure mounted. Kogan was already swarming the gurney as it locked into place.
"Talk to me! What do we have?"
Male, 24, active duty. The paramedic rattled off, breathless. Collapsed during PT. Blunt force trauma to the chest earlier in the week. Dismissed as bruising. He dropped like a stone an hour ago. BP is 60/40 and dropping. He's circling the drain. Elias pushed his mop bucket to the far corner, his limp becoming pronounced as he moved. It was a stiff, grinding gait, the result of a jump into bad terrain 2 decades ago, a memory etched into his tibia. He parked the bucket and stood in the shadows near the Sharps container, his head bowed, waiting for the inevitable spill he would be called to wipe up. But his eyes, pale grey and uncomfortably sharp, were not looking at the floor. From beneath the brim of his faded blue cap, Elias watched the monitor. He watched the rhythm of the soldier's heart. It wasn't just a jagged line to him, it was a language. And right now, it was screaming. The soldier on the table, Corporal Danton, was young, too young. His high and tight haircut was matted with sweat, his dog tags jingling softly against the metal railing of the bed as he convulsed. Danton's skin was the color of wet ash. Fluids. Kogan barked, his voice cracking an octave too high. "Hayes hypovolemic. Look at that pressure. Hang 2 bags of O, neg, and get the pressure infuser. We need to fill the tank." Elias's fingers twitched at his side. A muscle feathered in his jaw. Wrong. The word echoed in Elias's mind with the weight of a gavel. He watched the soldier's neck. The jugular vein was distended, roping out like a thick blue cord against the pale skin. The boy wasn't empty, he was full. His heart wasn't failing to pump because of blood loss. It was failing because it was being strangled. "Doctor," Nurse Holloway said, her voice hesitant. She was older, seasoned, the kind of nurse who knew when a doctor was guessing. "Breath sounds are clear, but heart tones are muffled. Are you sure about the fluids?" Kogan spun on her, his eyes wide and frantic. "Do I look like I'm asking for a consultation, Holloway?"
"Look at the BP."
"He's crashing. If we don't get volume in him, he dies. Hang the damn blood." Holloway clamped her mouth shut, her professional mask slipping just enough to show fear, but she moved to obey. The hierarchy was absolute. The doctor ordered, the nurse executed, the janitor cleaned. Elias took a half-step forward. The movement was involuntary, a ghost of a reflex buried under years of silence. The fluids rushed into Corporal Danton's system. It was exactly the wrong move. On the monitor, the heart rate climbed, tachycardic, thready, desperate. The blood pressure didn't rise, it plummeted. 50/30. Holloway called out, urgency replacing her hesitation. He's not responding.
Push Epi!
Kogan screamed, sweat beading on his forehead. Why isn't he responding?
Get me the pads!
We're going to shock him if he arrests. Elias felt the cold creeping sensation of déjà vu. He had seen this before. Kandahar 2004. A dusty tent. The smell of burning diesel, a marine with a steering column crushed against his chest. You don't put fluid into a tamponade. You don't shock a heart that's drowning in its own sack. You have to cut. You have to release the pressure. If Kogan shocked him now, or kept pumping fluids, Danton's heart would simply stop beating. The pressure would crush the ventricle until it couldn't fill, and the boy would die on the table while Kogan played with electricity. Come on, Kogan muttered, ripping the soldier's shirt open, buttons scattering across the floor. Don't you die on me. Elias looked at the soldier's face. Danton's eyes were rolling back, the whites showing, terrified and vacant. He looked like every boy Elias had ever failed to save, and every boy he had pulled back from the brink. The janitor gripped his mop handle so hard the wood creaked. The silence of the room was heavy, broken only by the frantic beeping of the monitor which was slowing down. Beep, beep, beep. He's bradying down, Holloway shouted. Doctor. We are losing him, charged to 200, Kogan yelled, grabbing the paddles. Clear? No, Elias whispered. The sound was so quiet, it was lost under the hum of the defibrillator charging. Kogan was about to kill him. It wasn't a possibility anymore. It was a mathematical certainty. The young doctor was treating a trauma like a plumbing problem, and he was about to blow the pipes. The monitor let a long, hitched whine. Flatline! Holloway screamed. Assistol! Clear! Kogan shouted again, hovering the paddles over the boy's chest. The air in the room seemed to vanish. The world narrowed down to the plastic paddles in the shaking hands of an arrogant boy, and the silent, crushed heart of a soldier who had survived a war only to die in a sterile hospital room because of a title on a badge. Elias Thorne let go of the mop. It hit the floor with a clatter that no one heard. He wasn't a janitor anymore. The disguise had just become too heavy to wear. He stepped into the light. The sound of Elias's hand clamping over Dr. Kogan's wrist was sharper than the gunshot that had likely put Corporal Danton in this bed a week ago. It was the dry, snapping crack of bone meeting bone, a grip of absolute, immovable iron. Don't, Elias said. His voice was a low rumble, devoid of the frantic pitch that filled the room. It was the voice of a man who had given orders in places where the wind screamed louder than the dying. Kogan froze. For a split second, the young doctor's brain couldn't process the data. The hospital janitor, the limping ghost in the stained yellow jumpsuit, was holding him, restraining him. Then the shock turned to incandescent rage. Get your hands off me! Kogan shrieked, yanking his arm back. But Elias didn't budge. The paddles hovered inches from the soldier's chest, humming with 200 joules of lethal electricity. Security! Get security in here! This lunatic is assaulting me! You shock him. You kill him, Elias said, his eyes never leaving the monitor, though his hand kept Kogan in a vice. It's not asystole. It's blockage. Look at the monitor, doctor. Look at the patient. He has no pulse! Kogan spat, his face flushing a deep, blotchy red. He's flatlined! You're interfering with a code! Holloway, get him off me! Nurse Holloway stood frozen at the crash cart, a syringe of epinephrine halfway to the IV port. She looked at Kogan, then at Elias. She saw the grime on Elias's sleeve, the grey mop water drying on his knuckles, but she also saw his eyes. They weren't the glazed, vacant eyes of the confused elderly man she ignored in the break room. They were focused, terrifyingly intelligent and calm. Beck's triad, Elias said. He didn't shout, he didn't plead. He recited, distended neck veins, muffled heart sounds, hypertension. You pumped him full of fluids and squeezed the sac tight. His heart is swimming in blood, but it can't beat because it has no room to expand. Electrical capture won't fix a mechanical obstruction. He released Kogan's wrist with a shove that sent the doctor stumbling back into the ventilator. "Give me a 16-gauge spinal needle," Elias commanded, extending a hand toward Holloway, "and a 60cc syringe."
"Now, do not give him anything!"
Kogan roared, dropping the paddles. They clattered against the bed rails, discharging with a violent pop that singed the sheet.
"He's a janitor! He's psychotic!"
"He's right," Holloway whispered. The words hung in the air, heavy and treasonous. Holloway was staring at Corporal Danton's neck. The jugular was pulsing, straining against the skin like a garden hose with a kink in it. The pressure was building. The brain wasn't getting oxygen. The clock was ticking down the final seconds of viability. "The veins," Holloway said, louder this time. "Doctor, look at the veins. It's tamponade." "It's a crush injury," Kogan argued, though his voice wavered. He needs decompression." Elias cut in. He stepped past the doctor, moving into the sterile field. He didn't wash his hands. There was no time. He grabbed a bottle of betadine from the tray and splashed it over the soldier's sternum, the dark orange liquid pooling in the hollow of the boy's chest. "If we don't drain the sac in the next 30 seconds, he's brain dead." Elias didn't wait for Holloway to hand him the tool. He reached across the cart, his movements precise and economical. He bypassed the scalpel. He bypassed the clamps. His rough, calloused fingers snatched a packaged pericardiocentesis kit. He ripped the sterile packaging open with his teeth. "Security is coming," Kogan yelled, backing away, pressing the panic button on the wall. "You're going to jail, you hear me? You're done!" Elias didn't hear him. The room had narrowed down to a single point of entry, the subxiphoid space, just below the ribcage. He could feel the ghost of other needles in his hands. A dusty triage center in Fallujah. The back of a bouncing Humvee in Helmand. The anatomy of a human being didn't change, whether they were wearing a spotless hospital gown or a dust-caked uniform. He assembled the syringe and needle in one fluid motion. "Get ready to bag him," Elias said to the respiratory tech, who was staring at him with his mouth open. "When the pressure releases, he's going to gasp." "Stop." Kogan lunged forward, grabbing Elias's shoulder. Elias dropped his center of gravity and threw a short, sharp elbow backward. It connected with Kogan's solar plexus with a dull thud. The doctor folded over, wheezing, collapsing to the floor in a heap of white coat and bruised ego. Elias didn't look back. He positioned the needle at a 45-degree angle to the skin, aiming toward the left shoulder. Steady. The hospital was air-conditioned, cold enough to chill sweat, but Elias felt the familiar heat of the zone. The world slowed down. The beeping of the monitor was a distant metronome. He pushed the needle in. Skin. Fascia. Muscle. He advanced slowly, his eyes locked on the syringe barrel. He was navigating by feel, searching for the tough, fibrous resistance of the pericardium. 1 millimeter too deep, and he would puncture the myocardium, killing the boy instantly. 1 millimeter too shallow, and he would do nothing. Pop. A subtle give. The sensation of breaking through a thick sheet of paper. Elias pulled back on the plunger. Dark, non-clotting blood swirled into the syringe. It was the color of old wine. Elias whispered. The effect was instantaneous. On the monitor, the flat green line jumped. A jagged spike, then a rhythm. Beep, beep, beep. Sinus rhythm. Holloway breathed, her hands flying to the IV controls to dial back the fluids. BP is, my God, BP is rising. 90 over 60, 100 over 70. On the table, Corporal Danton's back arched. His eyes flew open, wide and terrified. He sucked in a massive, ragged breath, the sound of a drowning man breaking the surface. "Easy, son," Elias murmured, his hand resting gently on the soldier's shoulder, stabilizing the needle. "You're back. Keep breathing." The syringe was full. Elias disconnected it, expelled the blood into a basin, and reattached it, drawing more. The pressure on the heart was gone. The pump was working. "Doctor." Kogan was scrambling to his feet, clutching his stomach, his face a mask of humiliation and disbelief. He looked at the monitor. He saw the impossible rhythm of a living heart where a dead one had been seconds ago. "You," Kogan stammered, pointing a trembling finger. "You assaulted a physician. You performed an unauthorized invasive procedure." The double doors swung open with a violent crash. 3 security guards, burly and breathless, stormed into the trauma bay, batons half drawn. They saw the scene, the disheveled doctor, the blood on the floor, and the old janitor in the yellow jumpsuit standing over the patient, a needle buried in the soldier's chest. "Drop it," the lead guard shouted, leveling a taser at Elias.
Step away from the patient!
"Now!" Elias didn't move. He kept his hand steady on the needle. The procedure wasn't finished. If he moved now, the needle could shear.
I said step away.
The guard yelled, stepping closer, the red laser dot of the taser dancing on Elias's chest, right over the faded logo of the hospital cleaning service. Elias looked up. He looked past the guard, past Kogan, past the nurse. He looked at the soldier. "Breathing. Take the needle, Holloway." Elias said softly, "Secure the line." Holloway, trembling, stepped in and took the syringe barrel. "I have it." Only then did Elias raise his hands, not in surrender, but in the tired, heavy motion of a man who knew the war was never really over. "I'm stepping away," Elias said. The lead guard grabbed him by the collar of his jumpsuit, spinning him around and slamming him face first into the wall. The impact rattled his teeth. Cold steel cuffs bit into the wrists that had just saved a life. Elias Thorne. The guard barked, reading the name tag as he cinched the cuffs tight. "You are under arrest." As they hauled him out, dragging him past the stunned medical team, Elias caught a glimpse of his mop bucket in the corner. It was still waiting. The water was still gray, but the soldier was alive. The holding room in the hospital basement smelled of stale coffee and floor wax, the same wax Elias had spent 6 months applying to the lobby tiles. Now, he sat handcuffed to a steel table, the metal biting into the ulnar nerve of his left wrist. He didn't complain. He didn't ask for water. He sat with the stillness of a statue, his eyes fixed on the one-way mirror that dominated the far wall. He knew who was behind it. He knew the conversation happening on the other side. They were discussing liability, insurance, and the nightmare of public relations. They were not discussing the life that had been saved. The door buzzed and swung open. 3 people entered. The air in the small room instantly grew heavy with the scent of expensive cologne and fear. First was Dr. Kogan, looking cleaner now. He had changed his scrub top, hiding the sweat stains of his panic, but his eyes were darting, bloodshot and manic. Second was a man Elias didn't know, a police sergeant with a thick neck and eyes that had seen too many shifts. His name tag read Raw Oak. Third was the power in the room, Administrator Silas Krell. He was a tall man, thin as a whip, wearing a suit that cost more than Elias made in a year. Krell didn't look like a doctor. He looked like a calculator in human skin. He carried a file folder as if it were a weapon. "Take the cuffs off," Krell said, his voice dry, devoid of warmth. "He assaulted a physician." Kogan snapped, his voice shrill. "He's dangerous. He's 70 years old." "Aris," Krell replied without looking at the doctor. "And he's sitting in my basement." "Uncuff him, Sergeant." Sergeant Rook stepped forward, unlocking the cuffs with a heavy metallic click. Elias rubbed his wrist, the skin pale where the metal had pinched. He didn't say thank you. Krell sat opposite Elias, placing the folder on the table. He opened it. It was Elias's employment file. It was thin. A fake social security number, a fake address in a tenement district, and a work history that consisted of manual labor and silence. Mr. Thorne, Krell began, lacing his long fingers together. Do you understand the gravity of what happened upstairs? The patient is alive, Elias said. His voice was gravel, scraping against the polished atmosphere of the room. The patient, Kogan interrupted, slamming his hand on the table, is in critical condition in the ICU because you stabbed him with a dirty needle. You introduced a massive risk of infection. You compromised the sterile field. I decompressed a pericardial tamponade, Elias said, cutting him off. He didn't look at Kogan. He looked only at Krell. The doctor missed the diagnosis. He was treating for hypovolemia. If he had shocked him, the heart would have ruptured. The boy would be dead. Liar! Kogan shouted. He was vibrating with the desperate energy of a man whose career was dangling by a thread.
I was preparing to aspirate! I had the kit open, he tackled me!
He assaulted me and shoved a needle into the patient blindly. Elias turned his head slowly. The movement was predatory. For the first time, the facade of the janitor dropped completely. He looked at Kogan with the cold, dead assessment of a combat surgeon evaluating a triage tag. You were charging the paddles to 200 joules, Elias said. You were sweating. Your hands were shaking. You didn't know what you were looking at. You saw low pressure and you panicked it. Enough, Krell said. The word was soft, but it silenced the room. Krell looked at Elias, studying him. He was looking for the crack, the sign of mental illness, the delusion. But he didn't find it. He found a terrifying competence. Here is the situation, Mr. Thorne, Krell said, tapping the file. Corporal Danton is stable, his heart is beating. However, the official record states that Dr. Kogan identified the tamponade and performed the procedure. You, unfortunately, had a psychotic break and had to be restrained by security. Elias said nothing. He saw the play. The institution protected itself. The hierarchy remained intact. If we tell the truth, Krell continued, his voice reasonable, almost gentle, the hospital faces a lawsuit for allowing a janitor to perform surgery. The military investigates us for negligence. Dr. Kogan's career is over, and you go to prison for practicing medicine without a license, aggravated assault, and reckless endangerment. 10 years, but, Krell leaned in, if we stick to the official record, you are simply a confused employee who got in the way. You are terminated, effective immediately for insubordination, no charges filed. You walk out the back door and you never come back. The silence stretched. The hum of the ventilation system seemed to roar. It was a clean exit. It was the smart play. Elias could walk away. He could find another town, another name. He could disappear again. And the boy? Elias asked. Corporal Danton will receive the best care. Kogan interjected quickly, puffing out his chest. Under my supervision. Elias looked at Kogan's hands. They were still trembling slightly. The arrogance was a shell. Underneath, the kid was terrified. But fear didn't make you a surgeon. Courage did, and honesty. He needs a CT scan of the thorax, Elias said. The tamponade was secondary to blunt force. He likely has a jagged rib fragment near the pericardium. If he moves, it cuts him again. You need to go in and plate the rib, or he bleeds out tonight. Kogan scoffed. I don't need a janitor telling me how to. Write it down, Elias commanded. The authority in his voice was absolute. It hit Kogan like a physical blow. Check the third and fourth ribs on the left anterior side. Do it, or you're burying him by morning. Kogan looked at Krell. Krell stared at Elias, his eyes narrowing. He saw something there that didn't belong in a janitor's file. He saw a depth of experience that terrified him. Check it, Krell said coldly. But, check it? Kogan swallowed hard, nodded once, and backed out of the room. Krell turned back to Elias. He closed the file. Who are you? Krell asked. It wasn't a rhetorical question. You aren't Elias Thorne. You aren't a janitor. Men who mop floors don't know how to perform a blind subxiphoid puncture without nicking the liver. I'm nobody, Elias said, standing up. He rubbed his wrists. Am I free to go? Krell hesitated. He held the power to destroy this man, but he also sensed that he was holding a tiger by the tail. If he pushed, the man might bite back, and Krell had a feeling that if Elias Thorne bit, he wouldn't stop until the bone snapped. You're fired, Krell said. If you set foot on this property again, you will be arrested for trespassing. If you speak to the press, we will destroy you. Do you understand? I understand, Elias said. He walked to the door. Sergeant Roke stepped aside, looking at Elias with a strange expression, not contempt, but confusion, maybe even a flicker of respect. Elias walked out of the holding room and into the basement corridor. He didn't go to his locker. He didn't get his coat. He left his mop bucket, his supplies, and the few dollars in his pocket. He walked up the service ramp, emerging into the blinding afternoon sun of the parking lot. The air was fresh, smelling of exhaust and heated asphalt. He was free, he had survived. The lie was intact. But as he walked toward the bus stop, his hands felt heavy. He looked down at them. They were clean, scrubbed of the grey water and the floor wax. But he could still feel the vibration of the needle popping through the pericardium. He could still feel the life rushing back into the boy. He had saved a soldier. And for that sin, he had lost his sanctuary. He reached into his pocket and pulled out a small, crumpled piece of paper. It was the patient's sticker he had palmed from Danton's wristband before the guards grabbed him. Dun Tomaf US DOB 0412 2001. Elias stared at the date. He wasn't done. Kogan would miss the rib fragment. Kogan was too proud to look, too scared to find out the janitor was right twice. Elias crumpled the paper in his fist. He couldn't walk away. Not yet. The apartment was a box of drywall and silence, 3 miles from the hospital. It smelled of boiled cabbage from the neighbor's unit and the damp wool of Elias's only coat. Elias sat at the small, wobbling table, the overhead bulb casting long, harsh shadows against the peeling paint. On the table lay a single object, a leather-bound surgical field journal, its cover cracked and stained with the distinctive brown hue of dried blood. He hadn't opened it in 6 years. His hands, still raw from the handcuffs, he didn't need to read the pages to know what they said. He knew the names: Kowalski, Ramirez, R.T. Connell Vance. He closed his eyes and the silence of the apartment was replaced by the deafening roar of a rotor blade. Kunar Province, 2011. The dust was so thick it tasted like clay, the tent walls flapping violently. A man on the table, not a soldier, but a high-value target, a warlord with a bullet in his lung. Let him die, Doc. The captain had screamed over the noise of incoming mortar fire. We need the evac chopper for our guys. Let him die. But Elias hadn't let him die. The oath wasn't conditional. The physiology was human. He had clamped the artery, intubated the enemy, and loaded him onto the bird. And because of the weight, because of the delay, the chopper took fire on lift-off. It didn't crash, but it didn't return for the second load. 2 Marines bled out on the landing zone while Elias kept a monster's heart beating. That was the cost of the oath. That was why Elias Thorne was a janitor. He had been cleared of treason but convicted by his own conscience. He had traded his scalpel for a mop because a mop couldn't choose who lived. A mop just cleaned up the mess. Elias opened his eyes. The room was quiet again. He couldn't go back to that life, but he couldn't let the boy die because Dr. Kogan was too arrogant to check a rib. He stood up, the chair scraping loudly against the floor. He went to the closet and pulled out a heavy canvas bag. Inside wasn't a weapon, but something more dangerous in the wrong hands, a stethoscope. A Littman Master Cardiology black tubing, engraved with initials that didn't match his current name, JS. He put the stethoscope in his pocket. He pulled a dark beanie over his gray hair. The hospital parking lot was a sea of sodium, vapor orange light, and rain-slicked asphalt. It was 11:00 p.m. shift change. Elias stood in the shadows of the bus shelter, watching the employee exit. He wasn't looking for Kogan. Kogan would be long gone. Likely at a bar celebrating his save, Elias was looking for the conscience. 5 minutes later, Nurse Holloway pushed through the glass doors. She looked exhausted, her shoulders slumped, clutching a thermos like a lifeline. She walked toward a battered Honda Civic, fumbling for her keys. Elias stepped out of the shadows. Holloway gasped, dropping her keys. They jingled sharply on the wet pavement. She backed up against her car door. "Mr. Thorne," she whispered. "Jesus, you scared me. You can't be here. Security has your photo at every desk." "Did he run the scan?" Elias asked. He didn't move closer. He stayed in the rain, a dark shape in the orange light. Holloway hesitated. She looked around the empty lot, then bent down to pick up her keys. When she straightened up, her face was grim. "He ordered a chest X-ray," she said quietly. "AP and lateral. X-ray won't see a hairline fracture behind the pericardium." Elias said, his voice flat. "The heart shadow hides it. He needed a CT with contrast." "I told him," Holloway said, her voice rising with frustration. "I told him what you said. He laughed at me. He said, janitors don't dictate radiology protocols. He said the X-ray was clear. How is the boy?" "Stable. He's in ICU bed 4, sedated." "Stable is a lie," Elias said. "The jagged edge of the 4th rib is sitting millimeters from the repair site. Every time he inhales, the diaphragm pulls the pericardium down. Every time he exhales, it rubs against the bone. Friction. Eventually all slice." Holloway shivered, and it wasn't from the cold. She knew he was right. She had felt the competence in his hands earlier that day. She had seen the needle go in. "What do you want me to do?" she asked. "I can't order a CT. I'm a nurse. If I go over Kogan's head to the chief of surgery tonight, and nothing is there, I lose my license. I have 2 kids in college, Elias. I can't take that risk on the word of—" She trailed off. "On the word of a janitor." Elias finished for her.
Yes.
Elias stepped into the light. The rain dripped from the brim of his beanie, running down the deep lines of his face. "I need your badge," he said. Holloway recoiled. "What? No, absolutely not. That's a felony." "Give me the badge, Margaret," Elias said, using her first name for the first time. "I go in. I check the telemetry myself. If I see the artifact on the monitor, the specific ST segment elevation that indicates pericardial irritation, I'll leave. If I see it, I trigger the rapid response. I force the scan. And if you get caught, you dropped your badge in the parking lot. You didn't know." Holloway stared at him. She looked at the scar on his chin, the pale gray eyes that seemed to have seen the end of the world, and decided to keep walking. She thought about Corporal Danton, 24 years old, breathing on borrowed time. She thought about Dr. Kogan's trembling hands. Slowly, with trembling fingers of her own, she unclipped the plastic ID card from her scrub top. "Shift change is chaotic until midnight," she whispered, pressing the plastic into his rough palm. "The back service elevator near the morgue doesn't require a biometric scan, just the card swipe." "ICU is on the 4th floor. I know the floor," Elias said. He had mopped it for 8 months. "Elias," she said, as he turned to walk toward the building. He stopped. "Who are you really?" Elias didn't turn back. He gripped the badge tight. "I'm the guy who cleans up the mess." He moved toward the service entrance, his limp disappearing as adrenaline flooded his system. He wasn't walking like a janitor anymore. He was moving with the predatory grace of a hunter entering the brush. He swiped the card. The light turned green. Elias Thorne stepped back into the sterile world, not to clean the floors, but to finish the surgery. The service elevator opened onto the 4th floor, with a pneumatic hiss that sounded too loud in the quiet of the night shift. Elias stepped out. The ICU was a different world than the trauma bay. Downstairs was chaos and blood. Upstairs was a cathedral of technology and suspended animation. The lights were dimmed to a low, respectful indigo. The rhythm was set by the synchronized breathing of 12 ventilators, a mechanical choir keeping death at bay. He moved along the wall, his head down, clutching Holloway's badge in a pocket that felt like it was burning against his thigh. He wasn't a janitor here. He wasn't a surgeon. He was a ghost, an intruder in a sterile sanctuary. He counted the rooms. 1, 3, bed 4. The glass sliding door was open a crack. Inside, the only light came from the glow of the vitals monitor and the fluid pump towers. Corporal Danton lay elevated at 30 degrees, a pale figure amidst a tangle of wires and tubes. Elias slipped inside. He didn't look at the door. He didn't check for cameras. He went straight to the bedside. Danton was sedated but restless. His hands twitched against the restraints. His brow was furrowed, sweat pooling in the hollow of his throat. Elias pulled the stethoscope from his pocket. He warmed the diaphragm with his thumb, an old habit, muscle memory from a life he had buried, and slid it under the hospital gown, placing it gently over the fourth intercostal space. He closed his eyes. The hospital sounds faded. The hum of the fridge, the distant chatter at the nurse's station, the squeak of shoes, it all vanished. There was only the sound inside the chest. Lub-dub, lub-dub, scritch. Elias stopped breathing. He pressed the scope harder. Lub-dub, scritch. It was faint, a sound like leather rubbing against new leather. A friction rub. The sound of the pericardial sac dragging against something sharp, something rigid. The jagged edge of the rib wasn't just close. It was making contact with every beat of the heart. "You're walking on a razor blade," Elias whispered. Suddenly, Danton bucked. A cough, suppressed by the sedation, shuddered through his chest. The movement was violent. On the monitor, the EKG line fractured. The nice orderly waves turned into a chaotic scribble. The oxygen saturation number began to plummet. 92, 88, 85. The alarm didn't beep, it shrieked. A red light began to flash above the bed, bathing the room in a strobe of emergency. Elias looked at the chest. The cough had shifted the bone. It was pressing in now, harder. The tamponade was returning, but this time it was being driven by a spear of bone. Footsteps thundered down the hall. Elias had a choice. He could run. The service elevator was 20 feet away. He could disappear into the stairwell, toss the badge, and vanish into the city. He would be safe. He would be the janitor who got fired and drifted away. But Danton would die. When the team rushed in, they would see the drop in saturation. They would increase the oxygen. They would push fluids. They wouldn't look for the bone, because the X-ray said there was no bone. They would treat the numbers, not the patient, and the rib would slice the heart open before they realized their mistake. The door slid open wide. "Who are you?" a voice shouted. A night nurse, young, terrified, holding a clipboard like a shield. Behind her, a resident, not Kogan, someone older, tired, looking, rushed in. "Get away from the patient!" the resident yelled, seeing a man in a beanie and street clothes leaning over the critical bed. Elias didn't step back. He stepped in. He reached out with his left hand, his fingers splayed. He found the fourth rib, digging his thumb deep into the muscle, ignoring the softness of the tissue, searching for the floating segment. He found it. He pressed down, hard, and then pulled up, leveraging the bone fragment away from the heart. "Security! Code Violet in bed 4. The nurse screamed into her Spectralink phone.
Look at the monitor, Elias roared.
His voice wasn't the janitor's mumble. It was a command. It shattered the panic in the room. The resident froze, his eyes snapping to the screen. With Elias's hand digging into the soldier's chest, physically holding the rib in place. The saturation stopped falling. It held at 86. then ticked up 87.8. "If I let go," Elias said, sweat dripping from his nose onto the sterile sheets. "The anterior fragment of the fourth rib shears the right ventricle. Look at the ST elevation. It drops when I apply traction." "You're hurting him," the resident stammered, stepping forward, hands raised. "Sir." "Look at the wave," Elias barked.
"I'm splinting a fracture you missed!"
"If I let go, he bleeds out in 30 seconds. The resident looked. He really looked. He saw the correlation. The stranger's hand was a human clamp. "Oh my God," the resident whispered. "Traumatic motion artifact." "No, that's mechanical." Heavy boots hit the floor in the hallway. Security, 3 of them. They weren't the day shift. These were the night crew, big men who dealt with psychotics and drunks.
"Step away, taser! Taser!"
The red dots danced across Elias's back. "Don't shoot him," the resident shouted, throwing his arm out to stop the guards.
"Don't touch him!"
The guards froze, confused. The lead guard asked, baton raised. "He's assaulting the patient. He's stabilizing him," the resident said, his voice full of disbelief. He looked at Elias. He looked at the grimy fingernails, the cheap coat, the determination in the grey eyes. "I can't hold this forever." Elias gritted out through clenched teeth. His hand was cramping. The muscle spasms in Danton's chest were fighting him. "You need to intubate. You need to sedate him fully to stop the diaphragm movement. And then you need to open him up and plate this rib." I have to call the attending," the resident said. "Call him," Elias said. "Tell him to bring a saw." "Sir," the guard said, lowering the taser but stepping closer. "We have to secure you." "Secure me then," Elias said, not moving his hand. "But if you move my arm, the kid dies." The guard looked at the doctor. The doctor nodded slowly. The guard holstered his weapon and pulled out a pair of handcuffs. He approached Elias cautiously. "Right hand only," Elias said. "Cuff it to the bedrail. I need the left for traction." It was a surrender, and it was a victory. With a metallic click, Elias was chained to the bed of the man he was saving. He wasn't going anywhere. The anonymity was gone. The fake identity was burned. The janitor was dead. He stood there, his left hand trembling with the effort of holding the bone, his right hand shackled to the steel frame, waiting for the surgeons to arrive. He looked down at Corporal Danton. The boy was sleeping, unaware that his heart was beating in the palm of a stranger's hand. "I got you," Elias whispered. Something in Elias's life, his freedom, his hiding place, his peace, was gone forever. But the line on the monitor was green and steady. The cramping started in the thumb, a hot wire of pain shooting up the radial nerve. It had been 20 minutes. Elias didn't move. He didn't shift his weight. He was a statue carved from exhaustion and willpower, his left hand buried in the chest of a young man he didn't know, his right hand cuffed to the cold steel of the bedrail. The ICU room was no longer quiet. It was a theater of controlled panic. Dr. Sterling, the chief of trauma surgery, stood on the opposite side of the bed. She was a woman of 50, with steel, gray hair and eyes that missed nothing. She wasn't looking at the monitors anymore. She was looking at the portable ultrasound screen that the resident had wheeled in. On the grainy black and white display, the truth was undeniable. A white, jagged spur of bone, the fractured fourth rib, was hovering millimeters from the pulsing wall of the right ventricle. Every time Elias's hand trembled, the bone danced closer to the heart. Every time he steadied it, the shadow retreated. "He's right," Sterling said. Her voice was quiet, devoid of the hysteria that had filled the room an hour ago. "It's a flail segment with internal protrusion. If he hadn't applied traction, the pericardium would have shredded." Dr. Kogan stood in the doorway, his face pale and slick with sweat. He looked smaller now, stripped of his arrogance. "Chief, the X-ray was clear. I followed protocol. This man, he's a janitor." He broke into the ICU. He's holding the patient hostage. Has holding the patient together, Aris? Sterling said, not even looking at him. She looked at Elias. Can you hold it while we prep? We can't move him to the OR. The vibration of the transport will slip your grip. I can hold it. Elias rasped. His throat was dry as dust. But I need lidocaine. My hand is seizing. Sterling nodded. She didn't ask for a license. She didn't ask for credentials. She reached for a syringe from the crash cart, drew up the local anesthetic, and moved to Elias's side. This is going to sting, she said. She injected the lidocaine directly into the muscle of Elias's forearm. The relief was instant, the seizing muscle relaxing just enough to maintain the grip without the tremor. Sterile drape, Sterling commanded. We're going in right here. Thoracotomy tray, oscillating saw, plating kit. The room shifted. The hierarchy dissolved. There were no titles anymore, only the mechanics of survival. The nurses moved around Elias as if he were a piece of essential equipment. They draped the patient, covering Elias's arm in blue sterile sheets, leaving only his hand buried in the wound exposed. I need you to pull anterior and lateral, Sterling said, gowning up. I'm going to make a window. When I say release, you have to let go instantly so I can clamp the bone. Do you understand? I understand, Elias said. On your mark, Akrel? The administrator watched from the corner. He held a tablet in his hands, the screen glowing blue against his face. He wasn't watching the surgery. He was reading. His eyes were wide, scanning lines of redacted text and service records that had taken his security team an hour to decrypt. Sterling said. The blade moved. The smell of cauterized flesh filled the small room. Elias didn't flinch. He watched the monitor. He watched the rector. Sterling murmured, "Okay, I see the fragment. It's a razor. Good catch." She said the name with a pause, a question mark hanging in the air. "Ready to clamp," she said. "Release in 3, 2, 1. Release." Elias opened his fingers. It was an act of faith. For the first time in an hour, he wasn't saving the boy. He was trusting someone else to do it. There was a metallic snap as Sterling's clamp bit onto the bone. "Got it." She exhaled. "Bone is reduced. Pericardium is intact. We are clear." The tension in the room snapped like a rubber band. The resident slumped against the wall. The nurses let out breaths they had been holding. Elias pulled his hand back. It was covered in blood. The boy's blood, his own sweat. He tried to wipe it on his pants, but the handcuff caught him short, jerking his wrist against the rail. The rattle of the chain was loud in the sudden silence. Sterling looked up. She saw the cuff. She saw the janitor's uniform under the sterile drape. "Get those off him," Sterling said. "I can't," the guard at the door said, shifting uncomfortably. "Here's a suspect, ma'am. He broke into. Get them off." Sterling didn't shout. She just stared. It was the stare of a woman who held life and death in her hands every day and had no patience for bureaucracy. The guard looked at Krell. Krell stepped forward into the light. He lowered the tablet. He looked at Elias with an expression that was hard to read. Part fear, part awe. "Release him," Krell said softly. The guard moved. The key turned. The cuff sprang open. Elias rubbed his wrist. He felt incredibly old. The adrenaline was fading, leaving behind the ache in his bad leg and the deep, hollow exhaustion of the night. "Dr. Kogan," Krell said, his voice cutting through the room. "Please step into the hallway." "Sir, Kogan started. No, Kogan walked out, his head low. He knew. Everyone knew. The shift had happened. He wasn't the doctor who saved the soldier. He was the doctor who almost killed him, and the janitor was the one who had stopped it. Sterling finished the plating. She closed the incision with efficient, practiced staples. She stripped off her gloves and walked around the bed to where Elias was standing, nursing his hand. She didn't offer a handshake. His hands were dirty. She offered something else. "The approach you used," she said, her voice low so only he could hear. The subcephoid angle without ultrasound guidance. That's not textbook. That's field medicine. Old school. It worked, Elias said. I did. She agreed. Where did you learn to hold a rib like that? That's a thoracotomy maneuver, but you did it blind. I read a lot, Elias lied. It was a weak lie, and they both knew it. Krell cleared his throat. He was standing right behind them. He didn't read it, Krell said. He turned the tablet around so Sterling could see the screen. Elias Thorne doesn't exist. But the fingerprints on the mop bucket, they belong to Major Elias Vane, 1st Battalion, 75th Ranger Regiment, Chief of Forward Surgical Team 4. Sterling's eyes widened. She looked at the screen, then at the man in the dirty jumpsuit. Distinguished Service Cross, Krell read. Dishonorable discharge pending overturned in 2012 but never reinstated. You disappeared, Major. The military has been looking for you for a decade. Elias didn't look at the tablet. He looked at Corporal Danton. The boy was breathing. A steady, rhythmic rise and fall of the chest. The monitor beeped a strong, beautiful sinus rhythm. I'm just the janitor, Elias said, and my shift is over. He turned to leave. He expected the guards to stop him. He expected Krell to block the door. But Krell stepped aside. The guards lowered their eyes. Sterling watched him go. She didn't try to stop him. She stood at attention, just for a second, a subtle straightening of her spine as the old man limped past her. The hallway was empty. The floor was polished to a mirror shine. Reflecting the fluorescent lights overhead, Elias walked toward the elevator. He didn't run. He walked with the slow, heavy gait of a man who had carried a burden for a very long time and had just set it down, only to pick up a new one. He was free, but he was known. The elevator doors opened. He stepped in and pressed the button for the lobby. As the doors closed, shutting out the sterile world of the ICU, Elias closed his eyes and leaned his head against the cool metal wall. He had saved the soldier, but he had lost the shadows. The sun came up over the city like a bruise, purple and gold bleeding into the grey smog of the skyline. It was 6:00 a.m. The hospital shift change was in full swing, a river of tired scrubs flowing out and fresh coffee flowing in. Elias sat on a concrete bench at the Greyhound station, 3 blocks west of the trauma center. He held a paper cup of coffee that tasted like burnt nuts and cardboard. His duffel bag sat between his feet. It was lighter now. He had left the yellow jumpsuit in the locker. He had left the mop bucket in the corner of the supply closet. The water drained. The wringer handle turned inward, perfectly aligned. He was wearing his own clothes. Faded denim, a flannel shirt that had seen better decades, and the heavy coat that smelled of rain. Inside the hospital, the machine was resetting itself. In the administration wing, Silas Krell stood by the window of his 4th floor office. He was watching the street. He held the encrypted tablet in one hand, his thumb hovering over the "AIPA" button that would alert the Department of Defense to the location of Major Elias Vane. Krell looked at the digital profile. Combat Surgeon, Ranger, Ghost. He looked down at the bus station. He couldn't see Elias's face from here, just a small, solitary figure sitting in the cold morning light. Krell turned off the screen. He didn't delete the file. He simply closed it. He was never here. Krell whispered to the empty office. Down in the ICU, the silence was finally peaceful. Corporal Marcus Danton opened his eyes. The sedation had worn off, leaving him floating in a haze of pain medication and confusion. He felt heavy. His chest felt like it had been kicked by a mule. But he could breathe. Deep, full breaths that didn't catch, didn't rattle. He turned his head. Nurse Holloway was there, adjusting the drip on his IV. She looked tired, her eyes rimmed with red, but when she saw him awake, she smiled. It was a genuine smile, the kind that didn't happen often in this ward. Easy, Corporal, she said softly. You're back with us. The Danton licked his dry lips. The old man, he rasped. His voice was a wreck. The janitor. Holloway paused. She glanced at the empty chair where Elias had been chained just a few hours ago. The bedrail still bore a faint scratch where the handcuffs had bitten into the metal. "He's gone, Marcus," she said. He held my heart," Danton whispered, a tear leaking from the corner of his eye. It wasn't melodrama, it was the visceral memory of a hand inside his chest, holding him to the earth when he had started to drift away. "I remember his hand. He saved you," Holloway said, smoothing the sheet. "Him and Dokov. Where is he?" Danton asked, trying to lift his head. I need to tell him." Holloway shook her head slowly. "He doesn't want to be found, soldier. Men like him, they do the work, and then they disappear. That's the deal." The door opened. "Doctor." Sterling walked in. She looked fresh, scrubbed in, ready for rounds. But there was a heaviness to her walk. Dr. Kogan was nowhere to be seen. His name had been removed from the rotation board in the hallway. There had been no shouting match, no public firing, just a quiet conversation in a closed room, and a locker cleared out before dawn. Incompetence had been excised like a tumor. Sterling looked at the chart. She looked at the perfect staple line on Danton's chest. "Vitals are perfect," she noted. "You're going to walk out of here, Corporal, because of the janitor," Danton said. Sterling didn't correct him. She didn't defend the institution. She simply nodded, a gesture of immense professional respect. "Because of the surgeon," she corrected gently. Whatever he was wearing, he was a surgeon at the bus station. The loudspeaker crackled. "Bus 402 to Santa Fe boarding lane 3." Elias stood up. His bad knee protested, a sharp reminder of the jump into the Hindu Kush that had ended his first life. His hand, the one that had held the rib, ached with a dull, phantom throb. He picked up his bag. He had lost his job. He had lost the small, quiet apartment that smelled of cabbage. He had lost the 3 years of anonymity he had carefully constructed. He was running again. The algorithm of his life had reset to 0. He should have been angry. He should have been bitter that he was walking away, with nothing while the hospital would take the credit. While the insurance companies would bill for a procedure he performed for free. But as he walked toward the bus, the heavy diesel fumes mixing with the crisp morning air, Elias didn't feel bitter. He reached into his pocket and touched the stethoscope. He felt the cold metal of the diaphragm. He thought about the rhythm. Lub-dub. It was the only music that mattered. He handed his ticket to the driver, a man with tired eyes and a name tag that read ERL. Earl didn't look at him. He just punched the ticket. "Long ride," Earl grunted. "I've got time," Elias said. He climbed the steps and found a seat in the back, near the window. As the bus pulled out, lurching into the morning traffic, Elias watched the hospital drift by. He saw the trauma bay entrance where the ambulances were already lining up. He saw the janitors sweeping the sidewalk, clearing away the cigarette butts and the debris of the night. He watched them with a kinship that no one else would understand. The world saw the uniform. The world saw the mop. The world stepped around them, ignored them, looked right through them, let them look. Elias leaned his head against the vibrating glass. He closed his eyes. He wasn't Major Vane anymore. He wasn't Elias Thorne. He was just a man on a bus, heading west, with steady hands and a secret that kept him warm. He slept. And miles behind him, in a sterile room on the 4th floor, a soldier's heart kept beating, strong, steady, and alive. We live in a world that is obsessed with titles, with badges, with the uniform you wear and the rank on your collar. But the truth, the hard, beautiful truth, is that competence doesn't care about your resume, and heroism often wears the clothes of the invisible. Thank you for listening to this story, and for giving me your time today. If this story reminded you that the quietest people often carry the heaviest loads, I'd be honored if you shared it with someone who needs to hear it.